The latest and probably the best way to approach this is we want to partially block the CD38 receptors in the senescent cells, and we want to block NNMT, which is in senescent cells, some, but more so in cancer cells potentially. We block these enzymes partially to decrease the advantage that these abnormal cells may have. So we're not preferentially feeding the senescent and cancer cells, but feeding the good cells, if that makes sense. How we do this sometimes is we use molecules like apigenin, which is a partial CD38 blocker. We use things like 5-amino-1-MQ, which is an NNMT inhibitor. This takes away the advantage that these abnormal cells may have. Using 5-amino-1-MQ by itself, for example, by inhibiting NNMT, which is an enzyme that breaks down NAD, you can increase your natural pull of NAD without having to supplement. But if you are supplementing, you certainly should at least partially block this enzyme, again, to avoid preferentially feeding cancer cells. Also, there's another enzyme called NAPMT. This one is what recycles NAD naturally. Things like resveratrol can upregulate that enzyme. And so what I consider a healthy NAD supplementation regimen does not include only NMN or NR. It includes things like apigenin, 5-amino-1-MQ, and potentially resveratrol as well. And so with saying all this, the point here being, if you're seeing a clinic, these anti-aging clinics are popping up everywhere. If someone's just handing you NAD or NMN, NR, and saying, here, take this, you're going to be great, I would be very skeptical, and I probably would seek out someone that's got a little bit more knowledge. Certainly recommend doing your research, understand what you're putting in your body. Please just be careful, be cautious. Don't listen to just anyone who's telling you these things. Again, seek out somebody who's got a lot of knowledge or do your own research, and be confident and safe with what you're putting in your body.